Hi, my name's Alexandria Oussa and this is my presentation on probiotics. Probiotics are defined as live microorganisms which can be administered to increase health benefits, particularly in the gastrointestinal tract. Lactobacillus, bifidobacterium, and streptococcus are some of the most commonly used strains of bacteria found in probiotics on the market today. Probiotics are most commonly found in dietary supplement forms or are found in fermented foods, dairy products, and even soy products. Increasing evidence displays that probiotics have many beneficial effects. These include overall improvement of the gastrointestinal health, improved immune system, and reduction in serum cholesterol, just to name a few. While there is still some work to prove the overall efficacy of probiotics in all of these areas, it is more commonly established to improve the outcomes of diarrhea-related illness by shortening the duration of illness and preventing pathogen binding to the intestinal lining and prevention of antibiotic-associated diarrhea. The true mechanism of action of probiotics is unknown. It is believed that probiotics work by competitive binding to the intestinal lining with pathogens while simultaneously enhancing the immune response of the gut and replenishing the microbiome of the gastrointestinal tract that is commonly affected by viral, bacterial, and parasitic infections such as gastroenteritis and destruction of normal gut flora through the use of antibiotics. Probiotic quantities are measured in the colony-forming unit CFU. While there is no specific dosage suggested while taking probiotics, the larger the CFU, the better the outcome, as suggested in many studies when trying to study the efficacy of the treatment. Doses in probiotic widely available on the market can vary from as small as 100 million CFUs to 1 billion CFUs, which can be taken orally each day. There is no current evidence to display poor outcomes with higher dosages, except in some studies where the severe adverse reactions as seen in immunocompromised patients has been sepsis. Clinical studies such as peer review on the effectiveness of probiotics in children discuss probiotics have shown some beneficial use in treatment of intestinal illnesses such as viral gastroenteritis and antibiotic-associated diarrhea. While studying both inflammatory bowel disease and Crohn's disease, studies completed in children displayed little effects on relieving symptoms. However, none of the studies had large enough amount of participants or showed strong enough results to display benefits in taking probiotics as a treatment. Another peer review, which aimed to study the health benefits, has similar results when studying probiotics in the use of reducing the burden of acute gastroenteritis infections, most commonly caused by rotavirus. It showed inhibition of the virus to bind to intestinal cells and also decreased the virus overall length of time by 1 day. The only real issue seen in a probiotic efficacy trial was found in a trial where immunocompromised participants were involved. It displayed some adverse effects such as bacterial infections that could otherwise have been fought off in a healthy immune system. This suggests that those who are immunocompromised should take care when considering probiotics as a treatment for symptoms and speak to a specialist before deciding. A peer review conducted in the Journal of Pediatric Gastroenterology and Nutrition collated information from studies conducted on the effectiveness of probiotics on different illnesses. While some showed promising results, overall studies conducted showed inconsistent results when compared to other similar studies or were too small to be representative of the population. Most clinical studies on the safety or use of probiotics to treat digestive and non-digestive illnesses displayed some clinical relevance, but no statistical significance to display its true benefits. Safety has been discussed amongst many studies, and though there is serorizing of bacteria in probiotics to become resistant to antibiotics via interaction with pathogenic bacteria found in the body during infection, this has been found to be rare. Commonly used Lactobacillus GG or LGG has been utilized in many studies and has appeared to show little to no adverse effects in participants of clinical trials where it is being tested on a number of different illnesses. Adverse reactions are so low that when being studied in mice for its lethal dose, researchers were unable to conclude that it could be lethal if taken orally. Probiotics are relatively cheap and show some clinical evidence in use for gastrointestinal-related illness. This can be seen particularly in use for prevention and reduction of illness associated with gastroenteritis and antibiotic-associated diarrhea. Because probiotics are relatively cheap and unharmful, they can be useful for those with ongoing gut issues to improve the overall health of the gut through replenishing and maintaining a natural gut flora. This could be particularly beneficial for individuals who may lack dairy or any other products that naturally introduce good bacteria for normal gut functioning. Where probiotics are relatively safe and have shown to have many harmful effects in most individuals, those who are immunocompromised should seek professional opinions before considering probiotics for use, as they have been seen to have severe adverse effects in studies being undertaken for probiotic safety. Thank you for listening.